And when healed by secondary intention, the drawback of secondary intention is that it leaves scars. Is it clear? The drawback of secondary intention is that it leaves scar. Now, the third thing now is wound healing by tertiary intention. Wound healing by tertiary intention. Now, generally, you need to know that what wound healing by tertiary intention is an iatrogenic wound healing. Is it clear? It's an iatrogenic wound healing, meaning that it is created by the surgeon. It is the surgeon that creates a wound healing by tertiary intention. Now, a wound healing by tertiary intention consists of a primary healing with a secondary intention, and then a healing then later on by a primary intention. Basically, so it is a combination of a wound healing by secondary intention and then later on by primary intention. So let me explain how we need to do this combination. This combination is created by the surgeon. Now, tertiary intention wound healing. How does wound healing? How does a wound heal by tertiary intention? You need to know that what if you have a wound. Let's take examples of wound that heal by tertiary intention. If somebody has been cured by a cutlass that was present inside a pit of a toilet. Basically, let's imagine that the doctor sees that the patient was cut by a cutlass that was present inside a pit toilet. Is it clear? So in this case, a surgeon may reason in two major ways. Is it clear? In healing this wound, he may reason in the first way in healing the wound by primary intention. Is it clear? But now, when the doctor is going to heal the wound by primary intention, what happens is that he's going to suture the wound. Is it clear? Let's say that the patient has been cut with a cutlass that is coming from the pit toilet. He's going to suture the wound. When you clean and suture the wound, it means that that cutlass may have been infected, and when you suture like that, you are suturing bacteria underneath the skin. Is it clear? And when you are suturing bacteria underneath the skin, it's going to result to infection of that skin, which is going to result to wound dehiscence. Is it clear? And secondary superinfection of the wound and even scarifications. Is it clear? So that first doctor is going to take his decision, primary wound, primary intention, but that one is going to easily get infected. But now a second surgeon who now is going to do what is called a tertiary wound healing. Is it clear? And now, how do we do that tertiary wound healing? In this case, when you have been cut by a cutlass that is coming from a pit toilet and is highly infected, is it clear? A surgeon may decide for the first 7 days, that's the first 1 week. Is it clear? The first 1 week, the wound healing is going to occur by secondary intention. Is going to occur by secondary intention, meaning that the day the doctor sees the patient and that the patient has been cut, he does not suture the skin. What he does is only daily washing with normal saline and also covering with betadine. That's the only thing that he does in order to kill the bacteria which are present underneath the skin by that time for the first 7 days. Is it clear? So for the first 7 days, the wound healing is going to occur by secondary intention. Now for the next time, after 7 days now, the doctor now is going to suture the skin after a continuous wound dressing with normal saline and other wound cleaning agents. Is it clear? So you're now going to suture the skin for the wound healing now to convert to primary intention. So in this the doctor is now converting a wound healing from secondary intention up to primary intention in order to prevent scarification. But this first doctor, you see that since the doctor here has decided directly to close the wound without removing the infections, what's going to happen is that he has reason in order to take the wound into a primary intention. But now, since it's infection, the wound is going to convert from primary intention to secondary intention, and secondary intention is going to have scarifications. It's going to be hyperscarified. There's hypertrophic scar. So you see that in this doctor is going to give more marks to the patient compared to this doctor. That's why we are saying that tertiary wound healing is tertiary intention of wound healing is an iatrogenic wound healing. It is decided by the surgeon that is in front of you, and it is the best method that most surgeons takes nowadays. It is even thought that when you are seeing a patient that has a laceration, nowadays, it is for the first 3 days you should not suture that laceration, such that if there is any infection, it's going to be shown out or is going to be taken care by the immune system, and you can also clear off the infection by doing daily wound dressing. Now we do suturing after the first 3 to 7 days after this laceration to a patient, because after the first, we now convert from a secondary intention to a primary intention in order to prevent secondary infection, and it's going to prevent scarification. So just why most of doctors now think is the best method for the intention of wound healing. So now, after the intentions of wound healing, we now need to speak about granulation tissue, how a granulation tissue is good or not.